Hi, I'm Dr. Rob Rivera, and I want to have a discussion with you about the fact that you've decided to have one of the most advanced refractive surgeries that there is today, the implantable contact lens. I always have a discussion with patients that I want you to be aware of with respect to some of the risks that are present in your eye because your eye is nearsighted. The fact that you're nearsighted means you cannot see at the distance very well at all unless you go through either wearing glasses, contact lenses, or an operation such as the ICL. While we remove the nearsightedness with ICL surgery, unfortunately we don't remove the genes that made you nearsighted. So what's going to happen after your surgery is that your eye will genetically remain nearsighted, and that carries certain risks with it that you need to be aware of. These are not new risks once you have ICL surgery, but the risks have always been with you up to now, and they'll follow you after any type of refractive surgery that you have. The first risk has to do with the fact that everybody gets cataracts. Now, a cataract is simply a clouding of the lens inside the eye right here, where this lens becomes so clouded that it does not permit light to enter the eye normally, and people say basically that they see foggy or cloudy. One of the most common surgeries that we do nowadays is a cataract operation where we remove this and replace it with a lens implant. Now, in your case, being nearsighted, as I said, you do have, just like I do, and just like everybody else does, a 100% risk of cataract. However, being nearsighted means that you can actually develop a cataract early in life. And quite honestly, I've even taken care of patients who are less than 20 years of age, younger than 20, who developed cataract simply because they had a high level of nearsightedness. Their eye said it was time to develop cataract. The important thing is that once you have ICL surgery, it is not any more difficult to take care of your cataract when it develops enough clouding to where you need surgery. The important thing to note is that once you've had ICL surgery, it doesn't make it any more difficult to treat your cataract. You simply go through a straightforward cataract operation the same way that anybody does, whether you're 25 or 75. It's the same type of procedure and very, very easy to fix. We have not found that cataracts occur at any alarming rate after ICL surgery. In fact, some of the studies show about a 0.3% incidence. Once you hit the age of 45 and have a -13 or higher prescription, the incidence of cataract formation increases to 5.4%. But in our experience, we've taken care of many, many patients and certainly don't see cataracts being a significant risk beyond the risk that you normally carry for being nearsighted. The second risk has to do with pressure inside the eye being too high, which is a condition we call glaucoma. In the case of glaucoma, what happens is the inside of the eye is creating fluid, but it's also reabsorbing it. Now, if there's not enough reabsorption or if there's too much production of fluid, it's just like if you put more air in your car tire, the pressure would go up. In the case of glaucoma, it ends up damaging the nerve fibers that make up the optic nerve in back of the eye. Once those fibers are damaged, there's no recovering them since it is nerve tissue. During ICL surgery, what we do is create a little tiny opening on the iris, just a little tiny opening up on top. It's underneath your upper eyelid. And that opening being inside the eye, it's not to the outside at all, but it allows the fluid inside the eye to constantly circulate more normally. Having that procedure makes it such that it prevents you from ever developing the worst kind of glaucoma that there is. Once that iridectomy is what it's called is done, you can never develop narrow angle glaucoma. Now, there are, though, other less severe types of glaucoma, but they're very sneaky and you would never know that you had them. So what we advise is that you have simply a yearly follow-up, a yearly exam. Somebody needs to check your eye pressure to make sure that it's not sneaking up on you. And once again, that's a risk just of being nearsightedness. The ICL does not increase that risk at all. Now, the third area of risk has to do with the retina, which is the nerve lining inside the back of the eye. The retina is an onion skin thin layer of nerve tissue inside the back of your eye, like the film in back of a camera. What happens is that in a non-nearsighted eye, it's basically round like this, but a nearsighted eye is more elongated. In the process of becoming elongated, the retina can become stretched or torn or even develop a hole in it. If that happens, the fluid inside the eye can sneak underneath the retina and cause it to peel off. That's what we call a retinal detachment. We actually have our retinal specialists check you ahead of time to make sure that your retina looks good. We are finding over 10% of our ICL patients coming in have already been found to have tears or holes in the retina or weak spots that require preventive laser treatment. If the retina specialist does find something there, a simple preventive treatment can keep that area from ever developing into a retinal detachment or basically a worsening retinal tear. Retinal detachments, unfortunately, are one of the causes of blindness, and being nearsighted and having a higher risk of retinal detachment, we want to make sure that you're aware that you also need to come in every year to make sure that your retina looks healthy, and also that if you're ever noticing that your vision is changing, you call us, even if it's on the weekend or a holiday or anything like this at all. Because if you have problems from a retinal tear or detachment, we can fix these very simply early on. But unfortunately, if you are like some patients who say, well, I know there's a change in my vision, but I'm going to give it a couple of weeks to see if it gets better, that only makes it worse. So please know that we're always around. You can call us on a holiday, weekend, after hours, or any such time. There's always one of us on call to let you know whether it's something important enough to be seen right away, or if you can come in basically for a normal routine scheduled appointment. We'd much rather be safe. These are your eyes. We certainly value the fact that you're going to spend good money to have a good ICL procedure done. It's very important that you know how to maintain your good vision throughout your life, even in the setting of nearsightedness that is genetic, as I say, with these risks that do follow a myopic eye. ICL surgery is my favorite operation to perform based on the outstanding results that we get with this. Once you choose ICL surgery, we really look forward to you having the best vision that there is. It is quite simply the best vision correction surgery that I have ever seen, and we're delighted that you've made the choice to pursue this in your life. It's going to change the way you see the world. Thank you again.